Hello, my name is Elizabeth Waits and I'm an MSN student at Eastern Kentucky University. I'm going to be presenting on Hepatitis C virus awareness and education program initiated this summer at the Jessamine County Health Department as part of my clinical. What is hepatitis C? Hepatitis C is a serious liver disease resulting from infection with the hepatitis C virus. It's known as a silent disease because people can get infected and not know it. Most people who become infected end up with a chronic or lifelong disease. Hepatitis C virus infection is a complex public health problem. It's characterized by a high prevalence of chronic infection, increasing the burden of hepatitis C associated disease, low rates of testing and treatment, and the prospect of current increasing incidence. Most people who may have hepatitis C are believed to be unaware of their status because of low rates of screening and testing, as well as the need for increased awareness resulting in missed opportunities by their providers for medical evaluation or to promote behavioral changes that might reduce disease progression and avert transmission of the infection. Jessamine County Health Department is an ideal setting to promote hepatitis C awareness and educational program because it identifies chronic disease prevention as one of their primary goals. The expansion of the STD clinic to include HCV screening and education were developed with regard to the Jessamine County Health Department's mission statement, which is to protect the public's health and environment by controlling communicable disease, encouraging healthy lifestyles, providing preventative screenings, and reducing hazards in the environment. Jean Kagan Price is the APRN nurse practitioner and project director of the STD clinic and will also be project director of the Hepatitis C awareness and educational program. The start date was starting in May 2004, beginning with observations, and is currently ongoing. Program goals were actually twofold. The first was to develop hepatitis C screening tool for patients that present to the Jessamine County Health Department who are at risk, and to be able to refer these patients for testing at another facility, and increasing the ability to treat and decrease the complications of hepatitis C. Secondly, the development of educational materials to increase awareness of the chronic hepatitis C infection and to identify behavioral changes and the importance of testing. And long-term, to write a grant for screening and testing to be completed at the Jessamine County Health Department to determine patients with hepatitis C antibodies. Inputs include community health educators, community health nurses, educational materials including screening sheet, educational fact sheets, and educational brochure, and patients at risk for hepatitis C virus infection. Outputs include the number of patients screened and referred for testing from the Jessamine County Health Department, and the number of patients at risk that were educated about hepatitis C and hepatitis C chronic disease at the Jessamine County Health Department. The short-term goal was to increase awareness and referrals if indicated for the high-risk group. The high-risk group includes baby boomers or persons born between the dates of 1945 and 1965, people who inject drugs or PWID, whether you've only injected once or even if it was a long time ago, chronic dialysis patients, recipients of blood transfusions or solid organ transplants prior to July of 1992, people with multiple tattoos and body piercings, AIDS and HIV patients, and people who've had multiple sex partners, men who have sex with men, known as MSM, and people who participate in rough sex. The long-term goal is through a state grant funding available from the Center for Disease and Control and Prevention, the CDC, that's currently available, and according to Kathy Sanders, MSN RN from the Kentucky Department of Public Health, is something that she is going to be writing with other people, will produce the ability to screen and test at Jessamine County Health Department and other health departments in the state. The impact will be patients living in the community of Jessamine County will have the ability to be screened and referred for testing of hepatitis C, increasing the ability to treat and decrease complications of hepatitis C. There are multiple studies evident that hepatitis C is a widespread healthcare problem, with 3% of the global population chronically infected with the virus, and an additional 3 to 4 million people newly infected each year. The Jessamine County Health Department currently has about 25 cases a week reporting to the STD clinic, and of these patients, many have at-risk factors for hepatitis C. The incident report for hepatitis C in the United States was 3.2 million. Of the 3.2 million, 75 to 80% of those patients will develop a chronic infection. 60 to 70% will develop chronic liver disease. 5 to 20% will develop cirrhosis, and 1 to 5% will die from consequences of chronic infection, including cirrhosis and liver cancer. Incidence of acute hepatitis C was declining from 1992 until 2010. However, there's been an incline since around 2005. In northern Kentucky, they have nearly 10 times the national rates of hepatitis C, an 80% increase in 2013 over just the 2010 data. And according to Jessica Schultz, the health department's epidemiologist who investigates hepatitis C, this incline is continuing to increase. The National Center for Health Statistics of Hepatitis C reported acute new cases of hepatitis from 2005 to 2011, with actually a slight incline each year, with the exception of 2009, and in 2011 was 1,229. Estimated actual new cases of hepatitis C in 2011 was 16,500. An estimated chronic cases of hepatitis C in the U.S. is 2.7 to 3.9 million. The morbidity rates is the number of death certificates using hepatitis C as the cause of death. In 2010, there were 16,627 cases plus. The plus represents a fraction of deaths related to people not being tested for hepatitis C or the cause of death being liver failure. Evaluation of the project will be both quantitative and qualitative. Quantitative evaluation will be the number of participants that are screened, the number of participants referred for testing, and the cost of educational materials that will be absorbed by the Jessamine County Health Department. The qualitative will be observations actually by the nurse practitioner during office visits, including conversations with patients in regard to education screenings for hepatitis C and chronic management of the disease process. Inclusion of hepatitis C education and awareness in conjunction with the current STD clinic, the future of managing patients with chronic hepatitis C can be successful at the Health Department in Jessamine County. Successfully providing quality, culturally sensitive care, Jessamine County Health Department STD/hepatitis C program managed by the nurse practitioner can fill the gap and meet the need for addressing hepatitis C and hepatitis C complications. Here's the hepatitis C fact sheet that was initiated, a hepatitis C brochure, and there's references. Thank you very much. I hope you enjoyed this program.